Hey there, welcome back to the vlog, Recovering from Elbow Surgery from the Patient's Perspective. I have a really interesting, funny, analytical, data-driven topic today, so this may or may not be of interest to you, but here we go. At occupational therapy, and I went to occupational therapy, you may go to physical therapy. They're similar, not the same. Similar in the activities they do. The therapists are certified in different things and in different states. There's different rules, but occupational therapy, physical therapy, similar. I went to a place to do therapy to get my arm moving, okay? So at occupational therapy, the very first day, they had given me some instructions on some basic exercises. I would do this 10 times a day. I would open and close 10 times a day. I would wave 10 times a day. I would do some circular rotations, and then I would do something called the elusive, I'm going to do it with this hand, karate chop, because I still can't do it in my healing arm. Anyway, the karate chop. So you want to see yourself getting your arm straight, right? Because your elbow had surgery and it's probably was bent in a cast or some device, and you got to straighten so you don't get stuck. Or conversely, bring it closer so you can touch your head and bend all the way like this, right? So you want your arm to have a full range of motion. So in that regard, my occupational therapist came to me with this measuring device called a goniometer. And the measuring device measures angles precisely. So you would, and guess what? I have one. Being an analytical, data-driven person myself, like I want to know the why behind things, like give me the numbers to prove to me that the financials or whatever, so I'm very analytical in nature. And the very first day that she brought this goniometer out to measure the angle of where my arm was, right? So you put the circular point at the elbow joint itself, and then picture this part up towards your shoulder and this part towards your wrist, and you're opening and closing to see how far you can move the arm. How much range of motion are you getting? And essentially, if you start like this, you want your numbers to get better and better till you can, extend. So she approached me with this goniometer, and I was like, oh my gosh, and she calls it a goni, so I call it a goni. I was like, I need one of those. Like if I'm going to be doing these exercises at home, hourly exercises, 10 repetitions, every exercise. If I'm going to be spending that much time making sure I'm healing and getting myself better, I need to know my numbers. Like I want the data. So I ordered a goniometer, and I'll put a link, affiliate link, Amazon link. I won't get a ton of money, but if you click my link, I'll get a little commission. I'll put a link to the goni that I ordered on Amazon. But before it came in the mail, and me being as impatient as I was, like I wanted to know the numbers immediately that next day, I had to show this. My neighbor fashioned me my own goniometer. See the little hash marks to measure. And then he put a beautiful little flower because I love flowers. But it's two paint stir strips fashioned together with a bolt. And all it did was the same concept as the goni. So while I was waiting for Amazon to deliver me my goni, we had our own. So if you're into data and you want to know your numbers and you want to keep track of your progress as you improve, you may consider grabbing a goni. So again, link will be below. Comments or questions, please feel free to ask. Visit me at my website, elizabethscala.com. I help elbow surgery recovery patients through yoga and qigong, and I would love to connect. So thanks for watching, and I'll see you in the next vlog.